Hi everyone, I'm Alex Raymond at Empowered Eating here with another Mindful Minute. Today I am going to talk a little bit more about the blog that I wrote, which is what health professionals should know about eating disorders. Of course, I am a little bit biased because I am a dietitian in the eating disorder field. But I do think that it's very important for all health professionals to know how to properly identify an eating disorder and then refer out to proper care. If you think about it, a disease like cancer, the earlier it is detected, the better the prognosis and the better the outcome for the disease. And it's very similar to eating disorders. If an eating disorder can be identified early on in those very beginning stages, then these clients who struggle with disordered thoughts could possibly recover a lot faster than if they were to never get the proper treatment. So this is a topic that I'm very passionate about, and I really hope that all of you health professionals out there, your doctors, therapists, nurse practitioners, dietitians, physical therapists, physician's assistants, the list goes on. I hope that you read this blog and just learn a little bit more about what you should know about eating disorders. So I just quickly wanted to walk through the 5 things that I mentioned in the blog, and I definitely encourage everyone to read the blog for just a little bit more detail about these things that you should know. So number 1 is eating disorders do not discriminate, which means that anyone, and I mean anyone, can struggle with an eating disorder. So it's important that we eliminate that bias of people who are stepping into our office and are always doing some sort of disordered eating questionnaire when we see our clients. Number 2 is in adolescents or in kids, any drop in a growth curve is a cause for alarm. Even if the kid is obese or overweight, it's still important to really talk to them about why the drop may have happened, because it's very possible that they had gotten there through unhealthy means and should be referred out to an eating disorder dietitian for an evaluation. Number 3 is weight loss for binge eating disorder is not recommended. First, you really want to focus on addressing those emotional and nutritional concerns away from the weight loss. And I talk a little bit more about this in the blog, so I really encourage you to read that. I actually got some help from our dietitian Dana to highlight the fact that weight loss is not recommended for binge eating disorder. Number 4 is overweight and obese individuals can struggle with restriction. I can't tell you how many times that I've met with clients and they're actually not fueling their bodies enough, and they have a lot of disordered thinking around food, but because they are overweight or because they are obese, they think that they don't need the help, and they think that they need to restrict their diet even more. So I have to work with them to kind of unwind a lot of that thinking. And the last one is, and this especially goes for individuals who are struggling with anorexia, is even if the labs look normal, it's totally possible that the person is not fine. So I really try to encourage health professionals into thinking more about the verbiage that they're using when they're talking to eating disorder clients, because many times those individuals take the word fine as meaning that they don't need more help, when actually they could have really low bone density, or they could be at a really low weight, or maybe their blood pressure is dropping, or maybe their their blood sugar is dropping. So really just be mindful about using that word. And there was actually a 6th one that I didn't, that I totally forgot to mention. So the last thing to remember is encouraging someone to lose weight is not the answer. If you think about it, many people who struggle with eating disorders have been on that dieting cycle for years and years and years. And telling someone to lose weight as a solution to their problems is just not going to work, and it can actually be a source of frustration and guilt and shame for a lot of clients. So even, if someone has diabetes, high blood pressure, high cholesterol, other nutritional concerns, I really encourage you to tell them to, reach out to a dietitian and just learn more about how to work through these health issues without making weight the main problem. So thank you so much for listening to my Mindful Minute. Again, I really encourage you to read the blog because this was just a brief overview of everything that I wrote. So I'm Alex Raymond with Empowered Eating, and have a great rest of your day.